Hello, everyone. Welcome back to our channel, and to another enlightening episode of Family Planning, where we dive deep into the choices and methods available to help families shape their future. Today, we're getting into some real talk about options that give you more control over the long term and choices that offer permanence that work in harmony with your body. Now, you may have heard of methods like implants or the IUD, which can last for years with just a single visit to a healthcare provider. But did you know that the hormone released from an implant can protect you for up to 5 years, all without impacting your daily life? Or that the IUD can prevent pregnancy for an impressive 10 to 12 years? For those looking to make things permanent, we'll also explore male and female sterilization, methods that involve simple procedures but offer lifelong peace of mind. Whether you're thinking long-term or permanent, each of these methods is unique, with its own benefits and some things to keep in mind. So, let's jump in and see how each option works, and what makes it the right choice for different lifestyles and family goals. Ready? Let's dive into these powerful options and find the best fit for you. Implants. Description: implants are made of one or two small flexible rods, which are inserted under the skin of a female's upper arm by a trained health provider. The hormone from the rods can prevent pregnancy up to 5 years. Some of the implants available are Jadelle, 2 rods, effective for 5 years. Sino implant or Zerin, 2 rods, effective for 4 years. And Implanon, 1 rod, effective for 3 years. They can be taken out anytime by a trained health provider if the female desires to become pregnant or for any other reason. They must be removed after 5 years for Jadelle, 4 years for Sino implant and 3 years for Implanon, because they cease to be effective. How the implants works. Implants work by thickening cervical mucus, making it difficult for the sperms to pass through. They partially inhibit ovulation. They reduce sperm movement. Advantages of implants. Implants are safe and immediately effective after 24 hours. They can be used by females of any reproductive age or parity, and even when breastfeeding. Does not require the female to do anything once they are inserted. They do not interfere with intercourse. Return to fertility is immediate once the implants are removed. Limitations of implants. A trained health provider is needed to insert and remove implant. A small incision or cut is required for insertion and removal. Implants can cause menstrual cycle disturbances or changes. They provide no protection against STIs, including HIV. The intrauterine devices, IUDs. Description of IUDs. The IUD or loop is a small piece of plastic device placed in the woman's womb to prevent pregnancy. It can be inserted by a trained doctor, nurse or a midwife at any time, as long as the woman is not pregnant. When a woman wishes to become pregnant again, she goes to a family planning service provider to have the IUD removed. How the IUDs works. It causes changes in the womb. It thickens the cervical mucus. It prevents the sperm from meeting the egg. Advantages of IUDs. The IUD is very effective at preventing pregnancy. It is safe and easy to use. It prevents pregnancy from the day it is inserted. It does not require the woman to do anything once inserted. It does not interfere with sexual intercourse. Effective for preventing pregnancies for 10-12 years. The hormonal IUS is effective for 5 years. There is quick return to fertility after removal. Limitations of IUDs. A trained provider is needed to insert and remove IUDs. The IUDs may cause some discomfort immediately following insertion. There may be increased bleeding during menstruation. There may be spotting. There may be pain and cramping during menstrual period. It provides no protection against STIs, including HIV. Male sterilization, vasectomy. Description of the male sterilization. Vasectomy is a simple procedure in which the tubes that carry the sperm in a man are cut and closed. How the male sterilization works. When the tubes are cut, the man still produces semen, the milky fluid, during sexual intercourse, but there will be no sperms in it. Since there are no sperms in the man's fluid, the female cannot get pregnant. The man can still have an erection and enjoy sexual intercourse after the vasectomy. He will look and feel the same as he did before the procedure. Limitations of the male sterilization. Vasectomy is irreversible. Only men who do not want to father any more children should consider this method. There is a chance of regret. A vasectomy is not effective immediately, so it is good to continue using condoms for 3 months after the procedure. There may be some pain and discomfort during and right after the procedure. It does not provide protection against STIs, including HIV. Female sterilization. Tubal ligation. Description of the female sterilization. Tubal ligation is a procedure in which the tubes that carry the woman's eggs to the womb are cut and blocked. During the procedure, a doctor makes a small cut in the woman's belly and closes the tubes. How the female sterilization works. The eggs cannot meet the man's sperm, so the female cannot get pregnant. The female still has a period every month till she reaches menopause. She looks and feels the same as she did before the procedure. Advantages of the female sterilization. Tubal ligation is very effective. After the procedure, there is no more worry about pregnancy. It can be done soon after the birth of a baby so that readmission to the hospital or clinic is avoided. Limitations of the female sterilization. Tubal ligation is an irreversible method. Only females who do not want any more children should consider this method. There is a chance of regret. It is expensive at the time of procedure, but there is no further cost after that. There may be some pain and discomfort during and after the procedure. It does not give protection against STIs, including HIV.